Welcome to the Darcy Wellness Show. My name is Geoff Darcy, and today with me in the studio is Dr. Arthur Gertler, a medical doctor, Kim Griffin, a nutritionist and acupuncturist, and together we all practice at the Darcy Wellness Clinic. I'm an acupuncturist and herbalist. And welcome, thanks for joining us today. Today we're covering Lyme disease that is amazingly prevalent around our area here, around Natick, Dover, the whole area. And so to kick off with Dr. Gertler, so can you just tell us what is Lyme?
Lyme disease is an infection by a spirochete bacterium similar to the syphilis bacterium. The technical name is called Borrelia burgdorferi, and it can exist.
Can you say that backwards 3 times? So it's a pretty nasty bacterium, though.
Yes.
Yeah, I mean, it's a very large bacteria, right? I mean, the spirochetes are a family unto themselves. Nasty little devils, that tough to get rid of.
Right.
Yeah. So, and maybe we could go to our first slide. So they are carried in our area by deer and chipmunks and mice, and that's how they get around. They carry the tick. But what actually does the tick need to do to infect and to give us Lyme disease, to give us that bad bacteria?
Well, all tick bites, especially the deer tick, which is the main tick that transmits the disease, do not transmit the disease. The tick has to be infected. In order for you to know that, it has to be analyzed. But approximately 5% of ticks are infected with the spirochete, according to reliable statistics. When somebody receives a tick bite, if they can remove the tick in the first 24 hours, they're pretty safe in not transmitting the infection. After 24 to 36 hours, there's a gray zone, and after 36 hours, if the tick is infected, it's likely it will transmit the disease once it bites you.
So the idea is you're out on a trail and you're walking around and you notice a tick on you. It's not to panic at that stage, because even if it's gone inside and is buried inside below the skin, it takes at least 24 hours for the infection to release from the tick into the bloodstream. Is that correct? Yeah. And if we could go to our next slide. So in Massachusetts right now, as you were saying, Kim, earlier, this is actually your slide, that we're the second in the nation for infection, and that some 4,800 confirmed cases. And could you tell us a little bit about the controversy around reported cases versus non-reported cases? Because it's going to be a lot more than 48, right?
Sure. According to the CDC, there's about 10% of cases that are actually reported. So we're only getting a small snapshot of...
So 4,800, chances are it's more likely 90% more than that, right? So we're looking at around a lot of people.
Yeah, big numbers.
So that's pretty scary, because we can see from that slide a huge increase from 2002, almost doubled, and then almost doubled from the year 2000. So the cases are really being increased, that are going up. So if we go back, Arthur, so what's the next step? When should you, so you had a tick bite, luckily it's under 24 hours, you knew you went for a walk 12 hours ago, you found a tick, you take it off. Not necessary to go and see your doctor at that point, but at what point should you go and see your medical doctor?
Well, the opinions vary on that. Of course, in something like this, if you do too much, you can't be criticized. I think not doing enough would leave some room open for risk for yourself. So probably the best approach, the most conservative approach, would be after every tick bite, whether you know the tick is infected or not, and that's hard to know, receive a prophylactic dose of some sort of antibiotic. The preferred one is doxycycline, and usually recommendations vary from 1 to 3 weeks. If you have a tick bite with an infection, with a skin rash, with the typical skin rash of erythema migrans, it's called, bullseye type lesion, that definitely calls for 3 weeks of antibiotics, and many people now are recommending 2 antibiotics.
So you're a Lyme literate doctor, you practice at the Darcy Wellness Clinic. So in your practice, when somebody comes in, do they bring the tick with them? Do they ask you to test the tick, or do you, if they suspect they have Lyme, do you do the Lyme blood tests? Or how does it look to you when somebody presents themselves?
Well, usually I see the patients when they've received conventional treatment and they've already been determined to have Lyme disease, or it's fairly certain, and they've already entered the chronic stage. So diagnosis at that point rests on other things. But if somebody has a tick bite, they've had a rash, and it looks like it's possible Lyme disease with symptoms consistent with the disease, we usually do a blood test and send it to a specialty lab that only tests for Lyme disease and its co-infections.
Right.
And that lab is called IGeneX. It's in Palo Alto, California. Their accuracy is very high. It's
so we'll talk about the discrepancy in the different tests, and maybe we could actually see a slide of what the bullseye rash looks like. So everybody out there, if you see one of those rashes on yourself or a loved one, then maybe you could explain what that signifies, Dr. Gertler.
Well, that type of rash that you see there on the slide is very typical of the acute rash that somebody gets when they receive a tick bite or some other type of infection caused by the Lyme spirochete. And that's very classic for the Lyme infection, the acute Lyme infection. In a way, that's good if you have that, because it does really point out to any healthcare professional that this should be considered Lyme disease and should undergo a certain well-organized protocol for treatment with antibiotics.
So that brings us to this idea of acute Lyme versus chronic Lyme. So that's an easy one to diagnose. Somebody presents to you in the clinic and they have a bullseye, but it's only 30 to 50% of people who get the bullseye. There's a high degree of percentage of people who don't get a bullseye who still have the Lyme on board. They still have the bacterium inside them, right?
Right.
So at that stage then, so the organized way of treating it is they go to their doctor, they see the bullseye, they get a course of antibiotics. How long is that course usually for acute?
Well, we recommend 3 weeks.
Yeah.
We were recommending just a tetracycline like doxycycline, but now people are starting to recommend 2 antibiotics for the full 3-week period of time.
And so hopefully by that 3-week period, the Lyme should be cleared from the bloodstream, the bacterium should be gone. But there is this idea that that doesn't, that some people don't know they've been infected, don't know to go and get antibiotics quite early on, and can progress where the bacterium, the Burgdorferi bacterium, can actually establish a beachhead in the body where the immune system hasn't kind of flushed it out, and then it becomes chronic. At what stage, what kind of symptoms are associated with the chronic phase of?
Well, after about 2 months, there's disagreement on this, but in my practice, I consider somebody who's been infected for about 2 or 3 months to be in the chronic phase. Not everybody would agree with this. There's some dispute. Some call that subacute, but I think you should treat subacute and chronic the same way. And most of the symptoms are classically the triad of fatigue, some sort of cognitive or mental dysfunction such as poor memory, mood swings, and joint aches. So joint aches, fatigue, and some sort of cognitive defects. The cognitive defects are very pronounced, not just a little forgetfulness, but a lot of forgetfulness. And the joint aches can vary. The fatigue is very important. It's not just a little fatigue, it's quite a lot of fatigue.
Yeah. And Kim, maybe we could go to our next slide, and you could tell us, Kim, about how to remove these ticks. You're out there on the trail and somebody comes across them. Its first reaction is it's so gross, the tick burying in. It's so unpleasant. So the idea is not to burn off.
Yeah, you hear a lot of people that try to take a match and burn it off. Not a good idea.
Yeah.
You actually want to get as close to your skin as you can with the tweezers, and to get the whole body of the tick and to pull it out. So it's good to keep some tweezers on you if you're out in the woods.
Yeah,
and,
especially these days. I mean, the ticks are just incredible, over Rocky Narrows right now in Sherborne.
Yeah.
They're massive amounts.
Yep.
So you pull it out with the tweezers, so you use antiseptic on the skin.
Yep, if you have it with you, it's a good idea to use the antiseptic and also to disinfect the tweezers. And if you're somewhere you can wash your hands or use a wipe to clean your hands, it's a great idea
Just
too.
in case there's no bacterium. Is that possible that it can squeeze out, Arthur, from the tick onto your hands, and then from your hands later you can infect yourself? Or is it's in the stomach, my understanding, right? That it takes a while for the tick to regurgitate the blood back into the system. That's the 12, 24 hour.
Right.
So unless you squish the tick, it's not very likely that the bacterium could be on your fingers, do you think?
That's right.
Yeah.
Well, even if they were on your fingers, the way this is transmitted is through like an injection through what we call parenteral. It's got to break the skin, break down the skin barrier. If you ingested it, most likely in small amounts, you would not get, your stomach acid would kill it.
Yeah, so it's when it goes directly into the bloodstream from the saliva of the tick.
So from what I've learned, it's just that you don't want to leave the head in. That's why you want to get as close as you can as possible so that it doesn't transmit bacterium.
So it's trying to get everything out, not just yank it out and leave the head
piece in, right.
Yeah, so it's pretty, anybody scratching, it's full of ticks. So it's not just the ticks are transmitted, through, I mean, I saw a picture, it's a bit gross to put up today in our slideshow, but I saw this picture where they had, it was behind the ears of a deer. And there must have been 100 to 200 blood-filled ticks behind and then of course when the deer is running through the forest, the blood-filled ones drop off and they have little babies that carry on the Lyme disease and get transmitted even further into, and also I guess mice and chipmunks. There's a lot of the Lyme eradication goes through the stone walls, because the stone walls are places that the chipmunks live and they can also be a source of contact with Lyme. So the idea then of the initial phase, it doesn't seem too bad. The idea of the acute phase where I myself had Lyme, didn't have a bullseye, went to the emergency room with a very high fever. Luckily a course of antibiotics was enough to clear it up. But we see in our clinics all the time, people, I'm thinking of one case now we've both treated, a teenage girl that came had no fever, no bullseye rash, just slowly progressed into chronic Lyme. After a year, was completely, decimated and lost 1 or 2 years of high school and is only now, after 3 years, just coming back in. So, it seems like the biggest danger is the unrecognized Lyme, where people don't recognize the acute phase can lead to a chronic. So as a medical doctor, then do you see all the time that people are misdiagnosed? Maybe you could tell us a little bit about the standard test, the Western blot test, that's 35% false negative.
Right. Yeah, that's a very big problem, and there's no easy solution to it in sight. Unfortunately, the standard test done in standard labs and medical labs and hospitals, the Western blot is only 60–65% accurate. And the other problem is that the concept of chronic Lyme disease as a valid entity is not established in convention medicine.
Well, let's talk about that a little bit. And so this kind of, two camps, as it were. One camp being the infectious docs versus Lyme literate docs, maybe. Right? I don't know how you would categorize it, but there are two very definite camps in this controversy. Why is that?
Well, nobody knows exactly why, but there is a very resolute concept in conventional medicine, primary care physicians, and mainly non-infectious disease physicians, outside of the infectious disease specialists, that do not consider chronic Lyme disease a real entity. Even some holistic doctors don't believe that this exists. But all you have to do is see 2 or 3 cases that are verified, and you'll be a believer overnight. And that's the big problem. These people go around from doctor to doctor hunting down these strange chronic symptoms, having to drop out of work, drop out of school. Many of them have to be confined to home, and they're not diagnosed until it's well on its way into a chronic phase.
So the idea of someone missing the diagnosis is quite common, because if you're from one school of thought, it doesn't exist past the acute phase. Right. And so if you go and see somebody with that kind of belief structure, hasn't worked with chronic Lyme, then it may not be picked up.
Right. And there have been a lot of cases that we believe have been mistakenly diagnosed as chronic fatigue syndrome, even Alzheimer's disease, ALS, Bell's palsy, even MS, that have turned out to be Lyme disease.
Wow. Maybe we could go to our next slide, where we can see some of the symptoms that are associated with the chronic symptoms. Then we see all the nasty little devils around the dime coin there. They are tiny, almost like a tiny little dot on a page, and they can still convey these terrible symptoms. So arthritic-like symptoms. I think a lot of people realize that with swollen knees or ankles or elbows that are red, that's often associated with Lyme. But maybe you could tell us a little bit more about some of the other ones. So meningitis, I mean, that's a scary one to misdiagnose, but it can also mimic meningitis, right? And some of it's high fever, headache.
Yeah. Of course, we have to also consider the co-infections that are transmitted with the tick along with the Lyme spirochete. There are three main ones, and some of these can produce some of the acute symptoms too.
Yeah, and one of my patients told me a story being on Fire Island, thinking they were having a heart attack, being rushed off of the island, couldn't find anything wrong with their heart, and but they tested positive, and they believed that the Lyme was responsible for the crippling heart pain he was in. So it can be, quite a long list of that's why it's called the great mimicker. The bacteria can mimic so many different diseases. So MS also.
Yes.
Yeah.
Yeah.
What's some of the more chronic cases that you've seen, some of the symptoms that are associated with them?
Well, interestingly enough, there was one particular fellow who was a stockbroker who was waking up every morning with overwhelmingly burning pains in the soles of his feet, lasting about 2 hours, and it was driving him crazy. He couldn't find any relief. He took every analgesic, some narcotics. It finally turned out to be diagnosed as one of the co-infections, Bartonella, cat scratch disease, which typically causes that. And
so the idea of a co-infection is that other bacterium and organisms can piggyback onto the tick and can also be transmitted along with Burgdorferi, which is the Lyme.
Right.
So what are some of the co-infections?
Well, the three main ones are Bartonella, which is another term is cat scratch fever, Babesia, which is a malaria-like organism. It's a protozoan like a malarial. And then the third one is called Ehrlichiosis or Ehrlichia, which is a little like something called Rocky Mountain spotted fever. It produces skin rash. One of these, the Ehrlichia, can be very, very serious as an acute co-infection. If it's acute and coincides with the onset of the Lyme disease, it can cause high fever, it can cause a quite severe and sometimes fatal infection, and that has to be recognized right away and treated. Fortunately, the co-infections are a lot easier to treat with antibiotics. They respond much quicker, even when they're chronic, than does the Lyme spirochete.
So most of those co-infections are involved in symptoms in the acute phase when you first get infected. Would that be?
Yeah, they can be, but...
which ones are more chronic, which go over months and years?
Well, it turns out that most of the co-infections are silent, and the way they're picked up is that later on, I guess we'll get into this, the Lyme disease doesn't respond to treatment, so you have to suspect an underlying co-infection, which makes the Lyme disease refractory or resistant to treatment. But the co-infections, there's some of the typical features. We only see it 20 or 30% of the time. But some people believe that almost everybody with Lyme disease has a co-infection. More often, you see statistics like 20 or 30% have co-infections. And the Babesia, which is the malaria-type infection, usually produces a very high fever and headaches. The cat scratch disease also can produce eye symptoms, burning eyes, can produce pain behind the eyes, and the pain on the soles of the feet. And the Ehrlichia typically produces a very small, widespread skin rash and very high fever.
So it's a very kind of complex symptom picture with the co-infections thrown in on top of the regular Lyme infection. So, for instance, the case you brought up with the soles of the feet, so the stockbroker, he was suffering primarily from a co-infection. Was that responsible for the pain?
Well, the co-infection was, but most of his debility, his symptoms were probably due to the Lyme.
Yeah. So some of, in your practice, Kim, you're an acupuncturist at the Darcy Wellness Clinic.
Yes, I am.
And so the patients that come to see you, what kind of chronic symptoms have you noticed? Have they fitted the same kind of picture?
They have. The ones that have been diagnosed with chronic Lyme previously had been diagnosed with things like juvenile rheumatoid arthritis and have had, symptoms of fibromyalgia and, joint pains and things like that. I've actually had a patient with burning feet, so I've seen a lot of the same symptoms.
Right. We'll talk a little bit later about the great role that complementary alternative medicine can play in the treatment of Lyme. Maybe we could go to our next slide. It shows that I had some rough figures, and that top map shows the hot areas for infections in the United States, and you can see Northeast is ground zero. It is the most infected area in the U.S., with New York leading, and then Massachusetts, and then in third is Connecticut. And so that we've had in this area 109% increase over 2006. That was up until 2008. 5% infection rate in Acton, just by looking at some of the figures there quite quickly. And there was a report in the press of Dover having a 10% infection rate. So the earlier graph that you showed earlier, Kim, on the infection rate in Massachusetts was 4,800 confirmed cases. Correct. But that's only being, that's underreported. That's only 10%. So we're looking at nearly 500,000 infections every year and doubling every couple of years. So this is really of epidemic proportions, wouldn't you say? Definitely. Yeah. I'm glad you agree, Arthur. Yeah, thank you. So we're going to see a lot more of this, right? I remember outside our own clinic, in the Darcy Wellness Clinic, one day I put our little sign that there was 10% infection rate in Dover, and about 5 or 6 people came in who were living in Dover, and they were saying, on my street, it's at least 20%, and on my street, another person said it was 30%, that they had counted the amount of people that had become infected. And the interesting thing was there was a study out of New Jersey where 14 townships in New Jersey in 2004, they measured the ticks in their community, and they found that it was 30% infected with Bergdorf Ferry in those ticks. And from 2004 to 2008, it went up to between 60 and 70%, that more ticks had the bacteria in them, so there was a lot more exposure going on to the bacteria. So it's really becoming, an oftentimes misdiagnosed. The idea of giving somebody antibiotics in the acute phase is pretty well accepted, but then when it goes into chronic, if it flares as arthritis of the knee, a rheumatoid kind of condition, oftentimes maybe some prednisone can be given that allows the bacteria to even greater run of the body, right, with the immune system incapacitated. So a greater awareness is what we need. What are some of the points that, Kim, you would like to point out to people, the greater awareness around ticks and Lyme?
I think the biggest thing is you have to make sure that you inspect yourself and those you live with and your pets, and make sure that you're checking when you come in from outdoors, because when you go to the doctor, there's no test that's going to give you 100% positive for Lyme disease if you've contracted it all the time. So you have to almost be your own advocate as far as walking into the doctor's office saying, I don't have a rash, or I do have a rash, and I have a fever, or I don't have a fever, and I think I was bitten by a tick.
Just to try to get it on the medical doctor's radar, to bring out more and more points. Yeah. Maybe we could see our next slide, and this kind of covers some of the, one of the major MDs in the Lyme field says that the illness present for at least 1 year, but you said earlier, Arthur, around 2 months that you would kind of start to think about it, and approximately when the immune system kind of breaks down to a clinical kind of significance, where it really starts to show up, persistent minor neurological involvement, and still have an active infection. In fact, we had a patient in our clinic who had antibiotics, IV antibiotics, for a year, and then retested positive at the end of a year. So how can this bacterium be so resistant to antibiotics?
Well, that's a good question, and that's unfortunately what we're finding. It's a stealth organism. It knows how to hide I might say that patient, once you develop the serologic positive test, the antibodies, they likely remain positive for life. So the patient may have actually been improved, and you just won't know it on the serologic testing. But the organism has a devastatingly cunning way of masquerading in different phases to evade immune attack and evade antibiotics. The intact bacterium, the intact spirochete, can be killed fairly easily by your body, but when it sees itself under attack, it quickly morphs into a state where it sheds its outer wall, its cell wall, making it a lot harder for antibiotics and your immune system to attack it. And then finally, when there's still more attack, it goes into a completely inert hibernation phase called a cyst. Mm-hmm. And this can exist in outer space for years. There's no activity, it doesn't reproduce, and it waits for conditions to improve.
It certainly sounds like a science fiction kind of bacteria. It's pretty scary. So we've got a few more minutes left. If we could see our next slide, I wanted to talk a little bit more about how at the Darcy Wellness Clinic, we offer more integrative complementary therapies like acupuncture and Chinese herbs, of which we have a very good formula, Andrographis paniculata being one of my favorite herbs that is used in other kind of spirochete diseases that have had a very good success rate, infrared therapy. And maybe you could tell us, Kim, how you approach it just quickly before we wrap up with acupuncture.
Sure. With acupuncture, I usually just address the patient's symptoms and then the root problem that's going on, being the spirochete.
So you're treating the person as a whole, trying
Exactly.
to build, not treating diseases, but treating the person.
Exactly.
Yeah, so raising up the whole immune response in general.
Sure.
And Arthur, just quickly tell us a little bit about your approach to treatment of Lyme.
Well, we use threefold antibiotics, at least 2, sometimes 3, for 6 months to a year. We use a whole compendium of herbs, our own personalized that Geoff has developed through his astute conditioning in this disease, the Chinese herbs. And we use a lot of supplements, vitamins, minerals, herbs.
So it's not just antibiotics only or herbs and vitamins only. We both combine both of them, that you'll have people take antibiotics and herbs and get acupuncture.
Right.
Yeah. And our last slide, before we really want to get the idea of prevention out there, about what people should really avoid. And one of my biggest, I think the biggest conveyors of Lyme right now in this epidemic really are pets. Mm-hmm. So many people either sleep with their pets or they allow them on the furniture. And even, my yellow lab, he'd go out in the woods, he'd bring in 10 ticks with him. At least we could see most of them. But if he was a black lab, forget it. So the idea of landscaping, clearing out all of the removal of leaves and grasses and tall grasses, taking away the environment of the tick, trying to reduce or manage deer populations, and just avoid tick-infested areas. And if you're going off trail on a walk, be very careful. Wear light-colored clothing, insect repellent also, and then common sense after being outdoors, remove clothing and wash the clothing at high temperature. So there's a lot that you can do. The best treatment of Lyme is really not taking it on board, is prevention. So wanted to thank you very much, Kim Griffin, acupuncturist and nutritionist at the Darcy Wellness Clinic. Thank you very much, Kim, for coming on board and
Thank you.
And talking about Lyme with us today. And Dr. Arthur Gertler, medical doctor, Lyme literate doctor at the Darcy Wellness Clinic. Thank you very much, Arthur, for coming on today and talking about Lyme. From me, Geoff Darcy, acupuncturist and herbalist at the Darcy Wellness Clinic, I wanted to thank you very much for listening today, and hopefully you'll catch our next show on holistic medicine. Thank you very much.